what exactly it is and how it's treated. Then I'm going to go into dementia, what it is and how it's treated. From there, I'm going to go into my research design, the purpose of the experiment, the subjects they use, some of the protocols and procedures they use, and then a conclusion. So, well, my background information seems to go away, but so basically, Alzheimer's disease is a form of dementia that affects the brain and affects memory, thinking, and behavior. And it's caused by prion in the brain. So prion is basically a deformed structure. So basically, during translation, when an mRNA comes to a ribosome, we've seen that tRNA creates amino acid chains, and these create polypeptides. And as they're created, they start bending and changing, and a protein has a specific shape. But when a protein is deformed, it loses its function. And basically, in Alzheimer's, when proteins in the brain lose its function and they start to attack the brain and cause it to deteriorate. So the prions cause memory function of the brain to go away, and this is called cognitive deformation. And Alzheimer's disease is a form of dementia, but in dementia, there are many different ways you can have cognitive deformation. This could be due to injuries of the brain or of the head. Like I said, prions. There's a specific form of dementia that I'm looking into called dementia with Lewy bodies, which is very similar to Alzheimer's disease, in which the same concept, prions mess up cognitive function in the brain. So this messes up movement, thinking, language, and memory. So with Alzheimer's disease, you have a higher chance of getting it if you are female, if you have high blood pressure, but these are statistically proven, but not scientifically proven. So right now they're working on a way to connect these some of these factors together, because when we look at all people with Alzheimer's, we see that the majority of them have high blood pressure and the majority of them are female. But some scientific factors of Alzheimer's are aging, but Alzheimer's isn't a normal part of aging, but it happens through aging, head trauma, and some other things. So now it's my research design. So the purpose of this experiment was to investigate whether there may be differences in the clinical course and changes in cognitive progression between dementia with Lewy bodies and Alzheimer's disease. So the subjects they used were 60 patients with dementia with Lewy bodies and 120 patients with Alzheimer's disease. And basically they matched every 2 Alzheimer's disease patients with 1 dementia patient, so they would be monitored together. And when they matched them, they regarded education, financial background, and basically their entire life background. And each dementia with Lewy bodies diagnosis was made using the consortium on DLB International Workshop clinical criteria. So basically, there is a group of scientists, a panel of scientists who they basically talk about the criteria for diagnosing someone with with dementia, and they're the DLB International Workshop. And then each Alzheimer's disease diagnosis was made with the National Institute of Neurological and Communicative Disorders and Stroke and Alzheimer's disease-related association criteria. So, the same thing, they will meet every year, and they discuss criteria for exactly how doctors are going to diagnose their patients with Alzheimer's disease. So the patients were tested from the first time they received treatment from the clinic to the time they reached their endpoint or checked out. And the word endpoint refers to a discontinuation of visits to the clinic caused by death, admission into a hospital, or institutionalization. And they were tested and evaluated every 12 months in order to find their survival chance. So this is how they analyzed their data. Values were expressed as mean plus or minus standard deviation, and a statistical analysis was performed using the unpaired and paired t-test, the V2 test, Mann-Whitney U-test, Wilcox and Stein rank test. The Kaplan-Meier survival curves were constructed to estimate the survival distribution for all patients, and log rank tests were used to compare survival distribution between groups. So results. So I'm going to start off with dementia with Lewy bodies, which is the straight line. So at 0 years after diagnosis, they have 100% survival rate because no cognitive decay has happened. But at 12 months or 1 year, they begin to lose some of their cognitive function until 36 months, or so 3 years after they're diagnosed, their cognitive function has decreased rapidly, and they have about 45% chance of surviving. But another year later, 48 months, well, their survival rate stays the same for a while, but then another year later, their survival rate begins to drop again. So at 54 months, their survival rate is now 25%, and they continue on that way until they reach their endpoint. And then with Alzheimer's disease, they have the same 100% survival rate until about a year, and then it begins to drop steadily. And at 36 months, for a short amount of time, about 6 months, their survival rate stays the same at about 75%, but then it begins to drop again. And then at 60 months, so 5 years later, they have a 50% survival rate. And this is basically an evaluation of every aspect of the study. So originally they had 60 dementia and Lewy bodies patients, but for the final results they used 56 of them, and they were ages 73 to 93, and there were 30 men and 26 women. They had about 8 to 14 years of education, and their symptoms were about 1 to 4 years, sorry. So the MMSC is basically the evaluation they did. So when they started at 0 years, most of them scored about 20, plus or minus 3.8. Then after a year, most of them were 16, the range of scores was 16 to 24. Then at 2 years, the range of score were 12 to about 22. So just from 12 months to 24 months, we see that their cognitive function is decaying rapidly. Then at 36 months, they are 12 to 22. So we see again that it's rapidly decreasing. At 4 years, they're at 9 to 17. And then at 5 years, they're about 6 to 14. So it shows that from baseline to 5 years, their cognitive function decreases rapidly. And then some of them actually have comorbid disease. So 18 of them had comorbid disease, 32%. And 15 of them were on prescription medicine, and 51 of them were using donepezil, which is a medicine for memory decay. And about 15 of them used neuroleptics and others. And with Alzheimer's disease, they originally had 120 patients, but for the study they used 111. So when they started, most of them were 71 to 23. There were 37 men and 74 women. And in education, most of them had 8 to 14 years, so same education with dementia and Alzheimer's. And the duration of their symptoms were longer, so because they lived longer, so they had about 2 years to 4 years. And at baseline, they scored lower, but the cognitive decay wasn't as fast as it was in dementia with Lewy bodies. So to conclude, dementia with Lewy bodies had a greater risk of admission or death because of most commonly fall-related injuries and bronchopneumonia, which is pneumonia in the lungs, but then Alzheimer's disease. But the two groups did not differ in the rate of cognitive decline. So basically, they lose function in their brain at the same rate, but patients with dementia would die quickly. And this is my bibliography. I'm not so clear on Lewy bodies, so could you elaborate and then explain why people with Alzheimer's don't have it? Well, a Lewy body, like I said with Alzheimer's, when a protein is misformed, it loses its function. So a Lewy body is basically a messed up protein, and it messes up function in the brain. So it's a different type of protein. So Alzheimer's disease patients, they have the same kind of concept where a prion messes up their function in their brain, or that's what's believed at the moment for Alzheimer's disease because it's not exactly clear. But a Lewy body is a different type of prion, so it's specific to patients with dementia with Lewy bodies. So if you were to evaluate the type of prions in a dementia with Lewy bodies patient with Alzheimer's disease, they would be different. And you find that in dementia with Lewy bodies, there's a specific classification of prions where they're called Lewy bodies, and those are in the dementia patients.
You said that at the beginning they had like 60, dementia had 60 people and then they only tested 56, and then Alzheimer's had 120 and they only tested 111. What happened to the other? Did they die or something?
So they didn't specify this very much, but they stopped their visits very early. So about they didn't actually reach any of the checkpoints. So in their visits to the clinic, they never made it to a year. So they left before a year. They reached their endpoint before a year, so they couldn't be used for the study because everybody else reached their endpoint from about 1 to 5 years or beyond that. Ms. Lonzo?
Thank you, Mr. Onamuba. I have a question about the significance of this study. What would you say this comparison between dementia and Alzheimer's gives to the field?
So now we can diagnose better, and we know greater differences with dementia with Lewy bodies and Alzheimer's disease. So some doctors won't confuse because when they're diagnosed, there can be certain confusions that cause them to give the wrong diagnosis, and then they start using the wrong medicine, and that leads to legal problems and things like that. But that doesn't happen often, but with this study, we can further eliminate that chance completely.
Mr. Nanaga, the study group only used about half as many patients had dementia, or I should say the Lewy bodies, as had Alzheimer's, correct?
Yes, sir.
And there was a greater death rate amongst the Lewy bodies patients, or quicker death rate among Lewy bodies patients, correct? Do you think that both the discrepancy in the amount and the greater frequency of death among the Lewy bodies patients could point to an perhaps even greater than what the data shows, an even greater deadly effect of the Lewy body disease, or were the percentages worked out in such a way that it negated the smaller test group for the Lewy bodies dementia as opposed to Alzheimer's?
Well, it could be both because most people have Alzheimer's disease. It's the most common form of dementia, but as we saw in data, the people with dementia with Lewy bodies, their decline was faster, so they lost brain function faster. But one thing to consider is that when they were getting their subjects, they matched every 2 Alzheimer's disease patients with 1 dementia patient, so they would be evaluated together and monitored together. So the 2 Alzheimer's disease cognitive decay would be compared with the 1 dementia patient's cognitive decay. So they would have about sort of equal percentages, and they would have correct percentages. So when you ask that question, I think that you should look at both aspects of that.
Thank you.
Ellen?
In your research, did you find any sort of treatment for Alzheimer's or dementia?
With Alzheimer's, there is Donepezil, there is galantamine, and what I'm saying, the words I'm saying aren't the commercial brand names. Like with Tylenol, scientifically it's ibuprofen, but with Donepezil it's Exelon. So there are, well, in my research I found three main medicines used to treat Alzheimer's disease. But because dementia happens, like Alzheimer's disease is one specific infliction on the brain, but dementia is a group. So it could be due to brain injury or with the Lewy bodies. So there are many different treatments for dementia. You might be doing, like to increase brain function, they might be doing puzzles, they might be going to therapy, and they might not have to take medicines, but be doing common things just to increase their brain function. But the medicines for Alzheimer's slow down the effects of it and the cognitive decay.
All right, thank you, Mr. Nunavut.